Welcome everyone to another Facebook Live session on Agent-Based Modeling. We're coming to you live from the NYU College of Global Public Health. Today we're going to be talking to a pioneer who focuses on modeling complex social, biological, and economic systems using agent-based computational models. We'll be talking to him and his student on the intersectionality of this type of modeling with public health. My name's Deborah Nakumaya. I'm going to be your host today, and I'm joined by NYU faculty member Dr. Josh Epstein and his student Harman Deep. Thank you guys so much for being here today.
Glad to be here.
And to our viewers out there, please don't forget to comment below. Leave both our panelists questions. All right, let's go ahead and get started.
Sure.
So what is agent-based modeling?
Okay. Agent-based modeling is a type of computer modeling that we use to study health, violence, economics, all sorts of things, migrations, and so forth. And the basic idea is we build artificial societies of software people, and we put them in environments where they interact with one another. They can mate with one another and have offspring. They can bump into each other and give each other diseases. They can fight over territory. They can segregate into different groups. They can do all the things that social science and behavioral science and even public health care about. And the idea is the agents can be a very diverse lot. They can differ from one another. They can be different software creatures. They can have different information. They can have different decision rules, different immunocompetencies, all sorts of differences. So they're artificial societies composed of heterogeneous or diverse software individuals who interact with each other. And the idea is when we have something we're trying to explain, like an unequal wealth distribution or a segregation pattern, to agent-based modelers, can you explain it? Means, can you grow it in one of these artificial societies? And we've had a lot of success growing things, even ancient civilizations and war and civil violence and all kinds of other things this way. And it's a powerful new method that has strong applications in public health, from chronic disease to infectious disease to Zika to catastrophic events. So we're very excited about it, and Harman is one of our very great students in this area, and we're looking for many more, and offer courses in this, and are just delighted to be here to advance this.
And you said he's one of your students, and now at NYU there is a lab, the agent-based modeling lab. Can you tell us a little bit about the vision for the lab? What do you work on, in that lab?
So that is actually quite interesting. I joined NYU in September 2017, and so did Dr. Epstein. So my reason for joining NYU was basically to build an initiative for transdisciplinary action, and where people could come together to work on things that they want to work on. And it's very much similar to the vision of the lab, which is basically, as Dr. Epstein discussed, that the lab works on social sciences or issues that concern public health, which often require interdisciplinary action. So the vision is basically having a platform for people to come together from different backgrounds and work on issues they care about.
Wow. And for you, do you guys obviously share the same vision? Do you have any comments on, starting the lab?
I certainly agree with everything Harman says. One of the real appeals to me of coming to NYU in September of last year was the university's enthusiasm about interdisciplinary modeling. And the idea of the lab is to be a real crossroads for all of NYU to put together interdisciplinary teams to study these complicated, big questions of the sort Harman is taking on in his dissertation. It's about the sustainability of social systems and resilience to environmental change and all these other public health and questions of justice and things like this. So the idea is the lab, yes, it's called the Lab on Agent-Based Modeling because that is a central technique in what we do, but we'd also welcome people who are not modelers at all, who know a lot about some domain and have teams that involve modelers and non-modelers and historians and doctors and what have you. We've had a lot of luck with very diverse teams like that, and want to continue that tradition in the lab and NYU.
And as you were explaining what agent-based modeling was, what concrete ways, can we use agent-based modeling in terms, of public health in terms of maybe disaster preparedness or epidemics? Or can you just speak a little bit?
Sure. I mean, we have a lot of work in that area. I mean, for example, we have done models of all types. There's toy models that can prove to be very useful, and they're very realistic, huge models. Yeah. So a toy model is one that we built for smallpox preparedness, and there had been a big debate about what the optimal vaccination strategy would be in the case of a smallpox event of some sort. And one school of thought was vaccinate everyone right now, and that's dangerous because the vaccine has terrible side effects if you're immunocompromised or have HIV or diaper rash or eczema or lots of other things. So that's not such a great idea. And the other idea was, Deborah shows up at the emergency room, she's diagnosed with smallpox, we give everybody in her contact, anybody she's bumped into in the last week, give them a shot. That's not practical if you were at O'Hare Airport. We don't know who that was. So the idea was, can you use a simple model to identify a novel vaccination avenue? And we looked at some of the history of smallpox and discovered that most transmission is in the hospital and the rest is in the household. So we thought, let's try this strategy in our toy smallpox model, where you pre-vaccinate hospital workers, and then if something happens, vaccinate just your household. That turns out to be really good. It doesn't involve mass vaccination. And the toy model identified a neat avenue. And then you can build big fancy models to really flesh it out and see how it would work in detail. So we sometimes build toy models to get an idea, and then we deploy the idea or test it in very big models, and we have full-scale 300 million agent US model that we published for pandemic flu, and we even have a planetary scale model that we've used with NIH and CDC for pandemic influenza. We built an artificial New York recently to study Zika, but it's a whole artificial, urban health dynamics platform that we want to use to study all kinds of other diseases, sexually transmitted, mosquito-borne, even drugs and addiction and possibly violence. So we have all sorts of health-related work that we want to do with these platforms and with the technique.
And I think a follow-up to what you just mentioned is, these modeling conditions, I assume, are very controlled and experimental. How do you find them transferable, even to the real world in terms of like the smallpox you mentioned, just immunizing, health providers in that area and just, my family, quote unquote.
Right, exactly.
Yeah, so like how transferable are these, models to the real world?
Well, now you're talking about politics. So we had the privilege of briefing our idea to the then Secretary of Health and Human Services and worked with very high people in Health and Human Services, and they liked this idea a lot. And there was effort to implement that policy, but a lot of the, I think understandably, there were insurance questions about would you give insurance to healthcare workers who have an adverse reaction? Is the immediate threat of smallpox actually significant enough for people to run that risk? And I don't think the government, it's not, modeling ends and then the government is a separate thing. Were they able to make the case for this sort of intervention or any real intervention? And they didn't really carry the day. But, that's because the perception of a threat wasn't significant enough to lead to large-scale effort. But the modeling experience was very useful, and we identified a novel path in the event that some other thing comes along that requires that sort of thing.
And speaking of, novel paths, in terms of, is it common knowledge that, we should evacuate in terms of disaster as opposed to like, what is always the best decision in terms of like modeling, shelter in place, taking maybe like New York City for an example?
All right, great example. So we have built these combined models that have, for example, a toxic plume, an aerosol, an airborne contaminant, and chlorine gas or some other bad, nasty thing that floats through the air. And there's a group of real physicists who study that plume, and the plume flows over a real artificial city with all the buildings correct, so you have all the fluid dynamics right. But it's populated with people who can disregard orders to stay in place or evacuate, but in stupid ways, and do all the things all the things you'd expect humans to do. And we built a whole artificial Los Angeles, and are building a whole artificial Lower Manhattan But I think the most interesting hypothesis, I think, that would be daring and interesting to advance is that, you know, you're in a post-evacuation age. All these mega cities, just forget about evacuating them. When you design a big city, or when you think about New York or Mexico City or, you know, Guangzhou or whatever it is, evacuation's just off the table. So you need to think about designing for a world where, I mean, partial evacuation is still possible, and you'd want to do that in the optimal way. And there's lots of optimization that you could conduct around that problem, sort of what's the maximum you could really evacuate. I mean, if everybody tries to evacuate, it's just massive congestion and there's more exposure.
Especially
I mean, it's actually self-defeating. So I think a whole line of work is sort of, what do you mean by urban resilience in a world where evacuation just isn't possible? And there are all these projections about how much of the world is going to live in cities, and I don't remember the exact percentage, but it's an arresting number.
70%.
Literally 70%.
Yes,
Okay, so lower bound is half the world's going to live in cities. So they're going to be monstrous things, and as you think about urbanization and environmental change, I mean, all of that is going to collide in ways that we need to model and get ahead of.
Yeah. And I mean, I want to ask you a couple questions. Well, is, you know, agent-based model, is that similar to AI, or are these very different things?
I mean, I often talk to my peers here at CGBH, and they often think that it's AI, but they're quite separate fields. In artificial intelligence, you're basically talking about how machines or computers can have some intelligence element. In agent-based modeling, it's basically the modeler who has the intellectual ability to build it or come up with the conceptual model of it.
Yeah, that's right. And we also, I mean, I think, to me, and I mean, we have a whole, this is going to be a big theme at the center. AI, to my mind, you know, in a bunch of areas, it's displacing humans, but it is not explaining them. So, but we have thought of ways to use AI.
I need to write that down, by the way.
It's a good line. It's a good line.
Yeah.
It's displacing humans, but not explaining them.
Yeah.
So, I mean, I can build a better chess player, but it doesn't tell me how humans play chess. And my favorite example is Kasparov when he beat Deep Blue, the great IBM. And he beat Deep Blue in a crazy move called a brilliancy in chess. It was a chess, you know, a queen sacrifice or some really arresting move. And he was asked after the game, well, how did you come up with that? And he said simply, it smelled right.
What?
So it's clear that humans are not playing chess the way Deep Blue is playing chess. And you know, AI can build a better chess player, but it doesn't tell us how humans play chess, you know. But the techniques of AI can be useful to us because instead of building individual agents, which we've had success doing, we're very crafty at that now, it's kind of an art form. Instead of building individual agents, you could just build a space of possible agents and have AI search the space for the agents that generate the target you're interested in. So I'm trying to explain some large-scale social phenomena. I'm still saying I want agents that'll grow that, but I'm not going to design them beforehand. I'm just going to design just vast search space of possible agents. They could be rational, they could be random, they could be imitators, they could be all kinds of things. And what mix of those actually does produce a replica of what you see? And different disciplines have different, you know, the economists have a rational actor, and psychologists have a not so rational actor, and all these people have different things. But you know, they could all be part of the search space of agent types, and turn an AI system, machine learning, or a genetic algorithm. There's all these great things. Have it search that space, and then you haven't designed the agent. You've designed the space, and it'll pick the most fit ones.
The fit ones, awesome. And you know, to our viewers out there, please leave our panelists awesome questions. I still have so many. You know, you once said, you know, we'll provide fully baked cookies, but welcome half-baked ideas.
Sure.
And you know, I think there's, you know, a lot of pressure on students to feel like, especially with this type of, you know, modeling, you know, type of complex modeling and all these type of, you know, disciplinaries, to be kind of more data-driven in a way. So, especially to do this, kind of work. So what would you say to that?
Forget that. Just come. What I meant when I said we'll provide fully baked cookies, but bring your half-baked ideas.
Yeah.
Is really there's no don't be. I mean, it's meant to be. It really is a lot of fun. And one of the neat things about agent-based modeling is it really removes the math barrier. I mean, all these systems are rule-based systems, and they're a very easy, zero barrier programming languages like NetLogo that we use. And we teach this in our course. We have Introduction to Agent-Based Modeling, and there's no prerequisites at all. No math, no statistics, no nothing. And we just take you from zero to build these artificial worlds. And if you want to calibrate them to data, then of course bring your data. And if you want to, but I mean, we believe in the full range of things. You can be like really hardcore. Here's my data, and I want to something about the data. And data, or you could just say, I just want to play with a model and see what this happens. We have a model that's just called Happies and Sads, which is a complete toy little model that produces just amazingly unexpected behavior. So if you do nothing but learn that simple rules can lead to completely unanticipated results, that's an advance in your own self-knowledge and your humility, and those are huge goals of modeling.
And I think one question I have before I take an audience question is, does the course use GIS at all?
Yes, some. Yes, I mean, our work uses GIS. Erez Hatna, who's my close colleague and also an advisor of Harmans, he's doing an independent study with Erez and me, and his thesis. So yes, but Erez is one of the real leaders on geographical information systems, geosimulation, spatial statistics, urban dynamics. I mean, he knows all about that. And these things like the artificial New York all unfold over a GIS map of New York. So it's a very important component of any models of actual spatial activity. Erez has wonderful models of segregation. In Israel, actually. He's got a whole reconstruction of that, and the work we've done on reconstructing ancient farming civilizations and things like this. So land use and all of that is a very important component of all the really, down to earth, no pun intended, implementations.
And an audience question from Marine Arif is, how can agent-based modeling be used to tackle, mental health issues around the world? And, right now mental health is like a huge thing,
Yeah.
So.
Well, the short answer is, that's a huge question, and I don't know the answer, but I think one of the really, I think it's a very important topic, and it's one of the areas where a departure from the kind of canonical rational actor would probably be very useful. I mean, in the little work I've done on neuroscience and trying to make agents cognitively plausible with neuroscience, things like post-traumatic stress disorder from fearful, shocking events is something you could model. I tried to build a very toy version of that in my book, Agent Zero. But I think generally, the role of emotion and emotional trauma and recovery from trauma and, contagious emotions and depression and all of these things are just the kind of topics that agent-based modeling is good for. Whereas the traditional mathematical social sciences are really focused on game theory, economics, on rational agents making well-informed strategic choices. And I think much of social science should focus on settings in which that really isn't possible, and agents are driven by forces they may not understand, but are nonetheless systematic and possibly contagious and so forth. So I don't know the answer. I think the question is great, and I think agent-based modeling might be well suited to it. And I know other people in our department, Emily Goldman, others are, we're all excited to collaborate on that topic.
Yeah, and we'll see where it goes from there. Yeah. For Harman, what is your background?
Well, that's an interesting question. Before, my background is basically in biology and chemistry, and I plan to study molecular biology for my master's. But in the first year of my undergrad, I actually participated in a contest by NASA to design a space settlement, which is a colony on space. It's not on any planet where humans can ideally live forever. And there was this requirement to sustain that people out in space, you have to have 100% recycle and everything needs to go back into the system. And I came up with a proposal for that. But following the contest, I actually was looking into developing that solution in real. And that's when I realized that by 2025, 2/3 of the world's population will live in water stress conditions. And that was the moment, what if I developed my solution for the planet and not just the space settlement? And that's the switch that resulted from molecular biology to environmental health science. And currently, just before coming to NYU, I actually looked into how there's a lack of effective global action, and that's what drove me towards agent-based modeling. That in agent-based modeling lets you create an environment where agents interact, and how in case of environmental resource scarcity, you can make agents take effective global action. So it's just combining international relations, international law, human cognition, environmental scarcity, and sustainability in just one place.
So guys, this is very, very disciplinary.
Yeah.
Like if I wasn't graduating, I would come join your lab. But what do you hope to get out, of your experience?
I don't hope to get out of the lab. So this has just provided me the platform to actually study all of the things that I care about. So just build my skills there and work on it.
We're hoping to keep him here
Yeah.
and find an interdisciplinary doctoral program where he can pursue these very deep and ambitious, admirably ambitious topics. So yeah.
And for you as a faculty member, what do you hope students that have so much passion like this to hopefully get out of the agent-based modeling lab?
Well, I mean, I hope that they can do new science and apply it in ways that make the world a more sustainable and just place for everyone. I mean, I'm not sure what else to say. I think it's liberating to do this kind of work. I mean, it invites you to ask questions and it improves your independence of mind and your criticality and your autonomy as a thinker. And they're powerful tools to ask new questions and and make scientific and social change.
And to follow up to that, why do you think it's so important to welcome students who don't really know what they want to do and just want to explore? Why do you think this is so important, at this time?
Well, as I say, I think modeling is really a way of teaching, that it's okay to ask any question you want to ask. I want to empower people to be critical and analytical and independent-minded. That's the real, that's an important goal. And building these models develops those sorts of instincts. It says, there's a million reasons to build a model. Everybody, when you say I'm modeling something, everybody says, oh, well, can you predict stuff? Well, there's a million other reasons to build a model. I mean, explain is different than predict, right? I mean, I can explain earthquakes with plate tectonics, but I can't predict them yet. I explain new viruses with evolution, but I can't tell you next year's flu strain. So, I mean, there's explain, but there's also, look at policy options, play with new ideas. There's a million reasons to build a model, and I wanted people to come to the lab and take our course and be liberated from these sorts of silly presumptions that it all has to be data driven and it all has to be predictive. Well, I've built a lot of models that have nothing to do with data, and there's a million things other than prediction. I mean, you can gain insight with the toy model, and you're not claiming to predict anything. So I think the idea is please come. And don't worry, just come. There's a million reasons to build models. We have easy ways to do that, and it's liberating. I want people to not be intimidated by models. I mean, I often say that the reason you learn all these modeling techniques is that you're not a prisoner of any of them, right? You're not a prisoner of your analytical tools. So I think that's an important goal, or a prisoner of anybody else's analytical tools.
And we have another question from the audience, and this is directed to Harman. The question says, can you talk more about projects and initiatives and long-term impacts of those?
Oh, sure. So it started with the freshwater crisis, but in 2009, 26 Earth scientists came together to come up with a planetary boundary framework that you stay within the limits of these 9 boundaries, and that's the prerequisite for sustainable development. But unfortunately, that was not included in the Sustainable Development Goals. It was appreciated. So the initiative basically focuses on the solutions we are right now beyond the safe limits for 4 of those 9 boundaries, and agriculture is the driver for each one of them. So my initiative is basically focusing on developing urban farming, which is a solution to all those challenges to bring us back into the safe limits. And that's the long-term impact of it, to just keep the society running. And just to add to that thing, that if students want to explore more about agent-based modeling, just in general, most of the time people study and they decide that what they're studying is going to determine what they will do. Things like agent-based modeling, or from my personal experience, participating in projects, do the things, participate in the projects, and that will tell you what you want to do. And that's you explore, and then you decide, okay, this is what I want to follow, and that is what I study.
Yeah, so discover, explore,
Right.
and then you can chart your path.
Exactly.
Another question is, what are the day-to-day activities of the lab? What are you guys, working on right now?
Well, I'm fairly recent to the lab, but that's kind of, I try to link all of the things that I'm doing on campus to the lab experience. So it's basically working on my initiative, but on the other hand, my initiative is basically more about the practical experience, practical things or practical solutions in the field. But there are other things to think about, that even though there are so many solutions that are developed worldwide, most of them are not exported or are not scaled up. So that's what I do inside the lab, that look at solutions, that why these solutions don't really work, or why are they not implemented worldwide.
And are you using this in the modeling system?
Well, yes. So it's basically looking at if like it's a model of states and people living within those states, and looking at how states basically accept those. Some states how accept those innovations while others don't, and how you can come up with solutions that help these solutions spread.
Yeah, and and that's what you're working on. Are there other things that's being done in the lab apart from this initiative?
Well, a whole bunch of, lots of different projects. I mean, Erez, Hatna, and I are trying to actually finish, a paper on this New York Health Dynamics Simulator. He's doing some work with the Department of Health on Shigella, New York Department of Health. We have ongoing activity in the whole area of inequality, why it happens, what are its drivers, how do you change it? And that work involves another theme of both the courses and the lab, are that some modeling is mathematical, and some modeling is agent-based and computational. And there are lots of areas, like the area of inequality, where the two of them can have a very interesting dialogue, where there are mathematical models, but they strip out a whole bunch of things, and then you can add those things in the agent-based model, and the two of them can converse in a way that's very illuminating. So we try to encourage the dialogue between mathematical models and computational models in the more advanced work that's going on. And again, the whole idea of the lab is that it spans the university. So to that end, I have several appointments in other schools, Courant Institute and Arts and Sciences and Tandon School of Engineering and Health. So the idea is that there will be projects at the lab that embrace all of those walks of the university and produce models that are, a lot richer than what you'd get from any particular discipline alone.
Yeah, and we have another question from Martina. What is the main limitation, I would say, if any, of using agent-based models to answer, causal questions?
Well, the whole issue of what are causes, in my view, is an active area in philosophy. Starting with Hume, who didn't really believe in causes. But that's a separate topic. I think the main limitation is again, if you're trying to, the data is you always need data to sort of say, okay, is this model really credible? What do you compare the output of the model to? And in the case of epidemics, sometimes we have very good data on diseases that are recurrent. So I can say, look, we know a lot about measles, and it recurs in a seasonal pattern that is sustained for a long time. And if the model doesn't give me that periodicity, it's the wrong model. And if it does, then at least we know we're in the right ballpark. But in a lot of fields, we're actually asked to model things that haven't evolved yet. So for example, a new strain of pandemic influenza. I mean, people are asking you, who should be vaccinated, and we don't know the strain yet. So there are lots of cases where you're asked to perform models in the policy world where all you can do is look at past cases and say, it's been credible before and we're going to bet on it here in the absence of anything else. But otherwise, I think the way you get at the whole issue of, somehow corroborating the model, I don't like the word validate any more than I do cause, but that's a separate topic. But data is the main limitation. The main limitation is, how do you calibrate the thing? The micro rules, how do you make sure those are good? And when you've grown something in the model, what's the macro data you can compare it to? Those are the main limitations. Otherwise, that's it. The third point would be that they are kind of rule-based. They're not the same clean analytical model as a differential equation. So some people would consider that a limitation, that they don't have the kind of closed form, neat analytical solutions that differential equations have.
I hope that answers your question, Martin.
Whatever.
So we're beginning to wind down now, and you are fairly new to NYU,
Yeah.
and you've done similar work at other institutions. You've also talked about how you're trying to connect different schools together, bringing together experts around the country.
Yeah.
But why NYU? What does the future of this type of work look like?
NYU is a very interdisciplinary. Universities have personalities, They're life forms in their own right. And, NYU is a very daring, interdisciplinary, boundary leaping, open-minded, irreverent kind of intellectual culture. And it's very hospitable to this kind of lab. And I was just very excited by the work we were doing here. We began doing all this Zika work, and I met more and more people. And the dean, Cheryl Hilton, and Bernadette Bowden-Albada, the associate dean, we were working on all these things and got to thinking, NYU would be a very hospitable place for this crazy type of interdisciplinary, daring thing that encompasses lots of different fields. And it just clicked, and the chemistry has been great, and the students are great, and I just think it's really good soil to do this sort of innovation in.
Yeah, I think my final questions to both of you would be, what inspires you to continue to do this work? What is the end goal for you personally?
The end goal is basically, there are always so many issues, everywhere around the world. And agent-based modeling, I did not know of agent-based modeling before coming to NYU, but I read Dr. Epstein's book, Growing Artificial Societies. So when I talk about that, these are the issues I care about, international relations or law and so many things. You can't always study all of them together. How about growing a society in a computer and looking at it that allows all of these dynamics to just play in real life? And you could just look at that and look at the interpretations of that and develop test solutions in that, and maybe hopefully have the real world impact.
So for you, it's real world impact. How about for you, Dr. Epstein?
Well, honestly, I hear that, and I think one of the main rewards is to have students like Harman. That's so great to hear. And to me, it is very gratifying as someone who was, one of the early people in this field, to see it flourish this way and have a home at a great university and have wonderful students. That's huge to me. Just personally, I keep doing it because I want to keep learning and growing and evolving and enjoying marvel at all the unexpected things these models do. And also, try to make the world a more just and sustainable place. And I think we can bring those worlds into view with these models, and that may help get us to those sorts of worlds.
Well, thank you guys so much for being. I've learned a lot. Our audience has probably learned a lot. I want to thank you to our audience for joining us today. Don't forget to please visit our website at publichealth.nyu.edu, and we'll see you next time on Facebook Live. Thank you.
Thank you very much.